webinar is Administrative Fellowship Program, and we're going to talk about what the program is, how you can apply, and what does it feel like to be an Administrative Fellow at our hospital. So before we go ahead and dive deeper into the content, let's start with some introduction and housekeeping rules. I mentioned at the beginning, when nobody could hear me, is that everyone who is joining us today is on mute only, since we have a large number of participants joining us today. You can interact with us using your chat and Q&A. You can find it either on the navigation panel or on the right-hand side. So let's go ahead and introduce some of the admin fellows and great members that we have in the room today. So first of all, we have Laura Gottlieb, who is the Director for Enterprise Learning and Development and also the Director for Admin Fellowship Program. We have Maggie Howell, who's our 2017-2019 Admin Fellow, Melissa Mink, who's our second-year Admin Fellow, and Jordan Graham, who just started with us. So welcome, Jordan. And with that, I'm going to go ahead and turn it over to Laura to walk us through the agenda.
Hi, welcome everyone. I'm so excited that you're on this call with us. We are going to cover a little bit about our culture and overview of Stanford Children's Health. It is a unique culture, one that has evolved, and it's a wonderful place to work. I've been here myself going on 11 years, and so really excited to share with you a little bit about our organization. We're also going to give you an introduction to the fellowship itself, which we have refined year over year. We are a lean organization, and so we have a practice of PDCA where we constantly improve our program, and with input from our sponsors, mentors of the program, the fellows themselves, as well as the supervisors of each rotation. So we're always improving the program. It has been nationally recognized by the NCHL in 2014, 2016, and 2018. So we are really proud of the program. We'll have the fellows themselves talk about the fellowship experience as well as post-fellowship transition, which I think we've made some wonderful improvements on in recent history, and we'll be sharing a little bit with you about that. We really are focused on retaining our talent. We've made a big investment, and we're really proud of how we've been able to place our fellows into our organization post-fellowship. The fellowship application process, we'll walk you through that as well, and then have an opportunity for any questions that you may have. We've already kind of gone through introductions, but I just want to take a moment to say a few words, about myself and my passion for this program, and then have each one of our fellows talk about their background and experience briefly before we jump right into the program. So just to share with you, I have been with this organization, like I said, going on 11 years. I'm really proud of where we are with the Administrative Fellowship. It is part of our leadership development strategy in that we are working diligently to create a really strong pipeline of leaders for our organization. And so that's something I feel very passionately about. I've been in a role early in my career where, troubleshooting problems and issues, employee labor relations kind of challenges, and came to the conclusion early on that when you have strong leadership, you have a strong organization. And when you develop and grow individuals, your organization grows and develops as well. So with that, I think I'm going to toss it over to Maggie Howell, who just finished her senior year, or senior fellowship year with us, so finished her 2 years rotation, and if you could share with us just a few words about where you came from and where you are now.
Sure. Hi, everyone. I'm Maggie Howell. I'm the recently graduated Administrative Fellow, and I'm now an Access Business Manager in Ambulatory. I came from Seattle, Washington, born and raised. I earned my degree in Healthcare Policy and Management from the University of Southern California and my Master's in Healthcare Administration from the University of Minnesota. I have been so fortunate and really enjoyed my last 2 years here, and I can't wait to tell you a little bit more about it today.
Next up, Melissa.
Good morning or good afternoon, everyone, depending on where in the country you are. My name is Melissa Mink. I am now the Senior Fellow, just finished my first year of the fellowship. I grew up in Northern California, went to school in Los Angeles, and studied business and communications. And when I graduated, decided to take a job in healthcare. So I worked at Kaiser Permanente for 2 years up in Oakland, California. doing marketing and communications for them, and then went back to the University of Michigan to get my Master's of Health Services Administration, and was very lucky and fortunate enough to get the fellowship here at Stanford Children's Health.
Great. And Jordan, you've been here now 5 days,
yes.
but we'd love to hear a little bit more about you, your background and experience. Maybe even tell us a little bit about your first week.
Yeah, so my name is Jordan Graham. I am the new junior fellow here at Stanford Children's. Just moved here from Seattle about 2 weeks ago. Born and raised in Seattle, went to undergrad and my MHA program at the University of Washington. But after college, like Melissa, I did work in healthcare for a couple of years and worked at Seattle Children's Hospital for the last 5 years. So really looking forward to learning about another pediatric academic medical center. First week has been great. I actually got to do our orientation with our new Chief Operating Officer on Monday, Rick, who was amazing, and a really good look into the executive support for this fellowship program. So excited to be here.
Thank you so much, Jordan. I'm going to turn it over to you, Maggie, to share a little bit more about who we are.
Great. I'm excited to tell all you all on the phone a little bit more about the environment that you'll be working in should you come to Stanford Children's Health. We are a pediatric and obstetrics healthcare system in the San Francisco Bay Area, and exclusively dedicated and in some ways uniquely dedicated to pediatrics and obstetrics. We're one of the few independent children's hospitals that serve both moms and babies throughout the full continuum of care. We are, as I mentioned, independent, meaning we fully function within ourselves as an entity, aside from a few shared services with the Stanford Adult Hospital, that we have our own board of trustees, our own C-suite, and are traditionally a top-ranked hospital by U.S. News and World Report, which we're very proud of the services that we can provide kids around the Bay Area and beyond, kids and moms. Next, we are an academic medical center. We are affiliated with the Stanford Medicine, the Adult Hospital, as well as the School of Medicine. So we have really interesting relationships where we can learn from and collaborate with two other incredible entities. And I think that really is an example of the rising tide lifting all boats. And finally, we're very proud of a brand new hospital that we just opened in December of 2017, which we colloquially call Packard 2.0. And Packard 2.0 is not only a beautiful patient family-focused hospital, it's also technologically advanced and environmentally friendly, which is something that I think we really wanted to prioritize, as well as Lucille Packard, our founding donor, really believed in the healing power of nature. And that's something that we wanted to support. So I'm excited now to tell you a little bit more about what we do. At Stanford Children's Health, as Laura said, we are a lean organization and we are constantly improving and making ourselves better. Our network, the goal of our network is to be located within 10 miles of every patient and family within the Bay Area. We now offer almost 600,000 pediatric outpatient visits annually. We just closed our fiscal year 13 days ago, and we have an updated number, which is very exciting. So really continuing to grow and serve patients all around the Bay Area. One unique component of living and working in Silicon Valley is that we're very technologically advanced, and we're doing great work around digital health, including launching our own mobile application, having extreme growth in our telehealth visits, and partnering with a digital second opinion program called Ground Rounds, which allows us to, again, increase our access to kids and moms around the country and even around the world. And lastly, our vision is to heal humanity through science and compassion, one child and family at a time. And this is something that I see exemplified every day with the people that we work with, not only on the administrative side, but with the providers that we get to collaborate with as well. We are a patient and family focused hospital. We love that individual interaction. And then we have this incredible research branch who are working on breakthrough discoveries that change the landscape of medicine. So you really get the best of both worlds working at Stanford Children's Health. share a little bit about the program. So now that you know about our hospital and what we do, I'm excited to tell you about the 2 years as a fellow, or as an administrative fellow at Stanford Children's Health. We are a 2-year program, so you get 2 years to really dive in to your experiences here. And we are what I like to call a hybrid program. I know many of you have probably heard of project-based fellowships or rotation-based fellowships. Here, again, you get the best of both worlds. We have 4 broad 6-month rotations: inpatient operations, outpatient operations, strategy and business development, and then a project or area or even areas of the fellow's choosing for the last 6 months. So it ensures that you get the breadth and understanding of the entire scope of care, but you also get the depth to be able to do project work within each of those 6-month rotations. Additionally, there's a triad of mentors in each of the rotations that consists of an executive sponsor, a supervisor, and a mentor. So you're very supported in your project work, and you're also sponsored to be able to attend high-level meetings during those rotations. So you're getting both the high-level perspective in the long-term strategy and the day-to-day boots-on-the-ground project work. We select 1 fellow every year, and that fellow not only gets to experience the structure that we just described, that fellow also gets opportunities for shadowing. Jordan, I know, just scheduled cases in the OR that she's going to shadow. It sounds like heart cases and a few neurosurgery cases, which are really exciting. You get executive exposure through one-on-ones with those involved in the fellowship, the triad structure, and beyond. And then you get to participate in several high-level meetings, which Melissa will tell you about as we dive a little deeper into our fellowship structure. So I'm going to hand it off to Melissa now.
And it's exactly as Maggie said, want to just give a little bit more detail into the leadership support that is offered with the administrative fellowship. So Paul King, our president and CEO, is the executive sponsor of the program. He allows us to sit in on many of the meetings that he hosts and also has monthly one-on-ones with the fellows. So you get a lot of executive mentorship from him. Laura Gottlieb, who is with us today, is the program director. She helps provide fellowship structure oversight, as she talked about doing a lot of improving throughout the years to continually make the fellowship better, serving as our liaison between senior leadership and the fellows, and also acts as our manager. So we do our performance reviews and monthly one-on-ones with Laura to make sure we are developing in the ways we'd like to be. Our Chief Human Resources Officer serves as the transition sponsor. So this person really helps our fellow recruitment effort when we are looking for the next fellow to join us. And then as the fellow is transitioning into their post-fellowship role, helps sort of provide some transparent and comprehensive overview into what might be a good route for the fellow to take post-fellowship. In green, you can see we've just sort of called out, as Maggie was talking about, that triad that you will experience with each rotation. So the sponsor at the top is usually a member of the C-suite, and that person hosts the fellow in his or her area, also allows participation in meetings and projects, and then has monthly one-on-ones. The supervisor is generally a vice president level, helps the fellow select some projects that align with his or her interests and what they might want to learn about or get involved with, helps the fellow sort of get immersed in their area and has bi-weekly meetings with the fellow. And then the mentor is really there to help guide the fellow through their project work, talk about any roadblocks they're facing, definitely has an open door environment, as all of them do, but meets the most frequently with the fellow. And just to go a little bit deeper, we wanted to share with you sort of the actual individuals who are have committed to the fellowship program and who participate. So you can see at the top, as we mentioned, Paul, Laura, and Greg, our previous Chief Human Resources Officer, actually just retired, so he will be replaced soon. Dr. Lund in the corner helps serve as our physician relations partner and just being able to speak with him and work with him on any projects that are involving physicians. And then you can see at the bottom in different colors the folks that are involved from your inpatient rotation, ambulatory rotation, strategy, business, and finance. And I won't go through their names, but just want to call out that all of these people, have made a commitment to be involved with helping to mentor the fellows and guide them through their 2 years at the organization and then their post-fellowship position. And it's a really wonderful opportunity to be able to learn from them. Quickly, to sort of look at a little bit more in depth at the fellow's first year. So I just completed my first year. I can talk a lot about this. When the fellow arrives in September, they do a lot of onboarding, shadowing, sort of getting to know the organization, jumping right into fellowship recruitment, and then start with their inpatient rotation. So they will be working with the triad there, figuring out what departments they might want exposure to or what projects they might want to get involved in. So that will last 6 months, and then the first year also consists of the ambulatory rotation you can see in green. At the bottom, we have some of the meetings that the first year fellow gets to go to, and I will not sort of explain what each of these are, but all of them have leaders from across the organization and some of them also from the Stanford Adult Hospital as well as the Stanford School of Medicine. And the fellow is very lucky to be able to sit in on those and observe and learn sort of the high-level priorities of the organization. And then moving into the second year, to quickly go through that, you can see in orange the second year fellow, which I will be starting very soon. We'll move into the strategy, business, development, and finance rotation. And then as Maggie mentioned, we have that extra time for the fellow to do a project or a rotation of his or her choosing. And I'm not quite sure what I'm going to do yet, but I will share that Maggie did her sort of personal rotation in digital health and had a wonderful time. So it's great that the fellow is able to get some very specific experience if they want it. And then at the bottom, again, you can see there are some different meetings that the second year fellow attends. These are more high level. For example, our board meetings. The second year fellow is actually able to sit in on those, which is a very limited list of folks who can go to those. So very great opportunities in your second year as well. We wanted to share a little bit with all of you about what it actually looks like to be a fellow and some tangible examples. So I'm going to go through an example of a project I worked on during my inpatient rotation. I referred to it as the Transfer Center Project, and when I first started, the organization decided that they wanted to start their own patient transfer center in the hospital. And a patient transfer center essentially handles all of the logistics when a patient needs to be transferred from an outside hospital or emergency department to Packard. So this includes what sort of transport do they need? Do we have a bed for them? Do they have financial clearance? There's a lot of different criteria that go into that, and we had to develop a brand new one. So we created new workflows and processes. You can see the picture to the right is some Post-it note process mapping that we did in many meetings, and we had to implement a new EPIC module, had to recruit and train staff. I actually was able to develop a 3-week training and simulation plan, which was wonderful experience. And just to call out some of the skills that I was able to develop: project management, operations, communication, a lot of meeting and training facilitation, stakeholder management, and policy creation. So there was sort of a whole lot of different stakeholders involved in this project. You can see in the bottom is our ribbon cutting ceremony the day we opened, and so it was wonderful to be the fellow who got to participate in helping the transfer center come to life. And now to continue sort of sharing tangible examples of what it's like to be a fellow, Maggie is going to share what a day in the life looks like.
Thank you, Melissa. So I want to preface this by saying this is a particularly busy day in the life, but I figured I would give you all on the phone more instead of less. This is an example of a day from my strategic planning or strategy and business development rotation. And I wanted to share it in particular because I think it gives a really good example of the breadth and diversity in a day that you might have. Additionally, I want to note that those calendar invites that are in white on the left-hand side, that little white bar, means that it's not actually a meeting. It's just time that I've dedicated on my calendar. So I don't want you to think that I'm sitting in meetings all day, every day. I do have time to eat and take bio breaks and take phone calls if I need to. So it's not too crazy here. On this day, I was working on a project to create, ideate, and edit the Mother-Baby Center's presentation for our Stanford Children's Health Board of Directors. So it was a great project that I got to be involved in and worked closely with a lot of physician and administrative leads to pull this off. So I started my day by planning for our call and doing a lot of prep to make sure that I was ready to take that call later in the day. Then I met with Melissa. This was in April, I believe, of 2019. And you can see we were already starting to plan the administrative fellowship recruitment plan. So as Melissa mentioned in looking at what you do as a new fellow and how you onboard, one of the first projects you're involved in is to be deeply involved in the new fellow recruitment process. So that was something that we started planning for earlier this year. Then Melissa and I both got on a call about a power user program that we as fellows got to join for the analytics team that helped us, enabled us to take a 2-day Tableau training, which we hope that all fellows can continue to do in the future. And we really enjoyed the opportunity that we got as fellows to be able to learn Tableau and to become competent in the basics. Then you can see in red that call that I was prepping for from 8 to 9 actually happened. So I got to work again with leaders from around our Mother-Baby Center to take that call. Then I sat down for a little bit of desk time, a little bit of lunch, and did some analytics for a different project around obstetrics for our community network at Stanford Children's Health. Did a little analysis in the fellowship. You certainly get used to spending time on Excel and other analytics tools. So if you like Excel, this is a good fellowship for you. Then I got to sit in 2 meetings as part of my strategic planning rotation that were not necessarily relevant to my project work, but that gave me insight to what was happening at the high level in strategy and business development. So those 2 meetings were the strategic partnership huddle and financial planning and service development. And finally, I ended the day with one of my favorite components of the fellowship, which are the one-on-ones with leaders. And this was just a great way to have a cap on the end of the day and ground a busy day in a personal relationship, which is always a priority for me. And I think it does give a summary of what might go into different days should you be a fellow here. Next. Melissa and I are so excited to talk about fellow relationships. One of our favorite parts of the fellowship is the relationships between not only the first and second year fellows, but the real fellow family that you get with all the fellows who have continued to stay at Stanford Children's Health post-fellowship. I will walk us through the top row. On the far left, you can see Melissa and I on her very first day at Stanford Children's Health. And the first and second year fellow frequently start out as somewhat of a mentor-mentee relationship, but gradually seem to transition into equal colleagues and friends. And I've certainly seen that with Melissa. Next, you can see Caitlin and Meher in the top row, dressed up on Halloween, which is one of our favorite days here at Stanford Children's Health, Thing 1 and Thing 2. And Caitlin and Meher are both still here at the organization. They were the fellows 2 years and 1 year above me, and we all still spend time together. And then on the top row on the right, Melissa and I, in February of this year, went to HIMSS in Orlando to learn about health and technology and to see how that would affect the future. We were really excited about that content. We also managed to sneak away on the weekend after the conference to visit Harry Potter World, which was definitely a highlight too. So we enjoyed a little butterbeer and had a great day. Melissa will walk us through the bottom row now.
Thanks, Maggie. All of these are bringing back memories. This is fun. On the bottom left, you can see Jordan, myself, Maggie, Meher, and Caitlin. So the past 5 fellows, we all got lunch on Jordan's first day to welcome her here. In the middle is myself, Meher, and Caitlin, and a couple of other of our colleagues went wine tasting in Napa. One of my favorite parts about being in the Bay Area is that you're so close to so many different places and fun things to do. So on the weekend, we got to go up to Napa to enjoy some wine and some sunshine. And then on the bottom right is myself, Caitlin, and Maggie. One of our favorite things to do together is take workout classes, and we have several workout studios very close to the hospital. So this is one day after work, we were taking a Barry's boot camp class and did a cheesy pose to remember it. So definitely a lot of sort of outside of work relationship building that you get to do with the fellows, and it's been really special to get to know everyone, become friends with all of the past fellows, and also use them as sounding boards to talk about issues I might be having or advice that I might need. All right, I'm going to hand this back to Maggie since she recently transitioned out of the fellowship. She's going to walk through that process.
Great, thanks, Melissa. So the end of fellowship transition and placement process is very close to my heart as I just experienced it. The goal of the fellowship, should it be a great fit, which fortunately we've had great luck in the past, is that the fellow can stay at Stanford Children's Health post-fellowship and find an appropriate role where they're really excited and can use what they've learned and the relationships they've built to have an incredible transition into a post-fellowship role. So we do hope that fellows stay on board should they want to, and should it be a good fit with the organization. Additionally, we offer the opportunity as part of that 6-month rotation, and Melissa touched on this, that is open for the fellows choosing, for the fellows to really begin their transition in the last 2 or 3 months of their fellowship. So by the time that the first day starts of their new role, they hit the ground running. And I think most importantly, one thing that I feel so fortunate about being a fellow here is that all of the fellows have had the opportunity to transition into an area that they're really excited about. And I'm excited in future slides to tell you about my journey for how I ended up as an Access Business Manager. I am quickly going to point out that Caitlin Crooks, who is the current Business Manager for Perioperative Services, and Meher Kachwala, who is the Program Manager for Digital Health, are both on the line today and are happy to answer your questions during Q&A. So we have our whole contingency here who would love to talk about post-fellowship and their fellowship experience.
I would love to say just one thing.
Yes.
So this is Laura, the program director. We have seen such excitement about the fellowship that we have executives that basically bid on talent, and they're very competitive to put together job descriptions, job titles, job opportunities for a second-year fellow to transition into a role within their area of responsibility. So it's become such an exciting way to really retain our talent, and then also just everybody is really enthused about it because there's been so much exposure. The fellows know all of the executives. The executives really know and trust our fellows and want to offer them the very best opportunity that we have. So,
thank you, Laura.
Yeah.
Yes. And the next slide walks us through that process a little bit. I appreciate the color, Laura. We're very lucky that we have such an involved executive team, and that's really thanks to you and Caitlin and Meher and the program you've built over the years. So, as Melissa mentioned, fellows will begin the program in September and then go through a whole year and a half of the fellowship, not really thinking about their post-fellowship job, maybe collecting experiences and thinking about, oh, I really liked this, or maybe this isn't where I want to be in the long term. But when post-fellowship really picks up is about January of their second year, so when they have approximately 8 to 9 months left. And the fellows start to have conversation about post-fellowship first with Laura, where we discuss the role that will be submitted into our position review committee, which is the process that Stanford Children's Health has to ensure that each role is appropriate and is budgeted. So the role is submitted, and the fellow begins to start having conversations with people around the organization who they might want to work for post-fellowship. So putting their feelers out. Often I found in my experience, that people approached me, hiring managers approached me, which is really, really flattering, and again, it speaks to, I think, the strength of the program that we have the opportunity to make those relationships. Then, once the role is discussed or is finalized through a very amazing process in which the CEO, the CHRO, and our wonderful program director, Laura, and the fellows sit down and look at the potential applications that Laura mentioned that the fellow receives from around the organization. They sit down, discuss what fits the best with the fellow's particular interests and talents, and crosswalk that with what is organizational priority and what's going to be a real long-term view of where Stanford Children's Health is going. And that's what those the executives provide. They provide that perspective. That discussion enables the fellow to pick their role post-fellowship and for the process to begin with the position going through position review committee. Then in June through August, maybe July through August, as the fellow is wrapping up their fellowship project, the fellow begins the interim role and is able to kind of dip their toe into what it's going to be like in their new role while retaining the meetings such as board meetings and high-level executive meetings. So they get to still finish out the fellowship with those one-on-ones, those meetings, but also start their transition into the new role. And finally, at the very end of August, the fellow officially transitions into their new role, which we hope is the outcome for every single one of our fellows. To give it a little personal flavor, I wanted to share my story about how I ended up in my new role as Access Business Manager. I started by, as I mentioned, in January-ish, exploring departments throughout Stanford Children's Health, some of which I have rotated through and a few of which I had not. Laura mentioned I was fortunate enough to be offered several opportunities to consider post-fellowship and was able to meet with the leaders and teams in those opportunities to think about what that might look like post-fellowship. I was then guided by our executive team and by Laura to make that post-fellowship decision. I got a great tool from Paul, our CEO, who showed me a matrix that he uses when he makes decisions, and I was able to use that very tool to really come up with what I thought was a clear answer for what I wanted to be post-fellowship. And as I mentioned, combine my unique strengths and personal interests to become the Access Business Manager. A few of the reasons that I chose this role is because I felt that most inspired in my ambulatory rotation, the Chief Ambulatory Officer, who is also the sponsor of the ambulatory rotation, Cameron Dial, she was an administrative fellow at a different organization, so she really gets what a fellowship likes or is like and what it maybe a fellow can bring to the table. I loved the idea of working on access and digital health, as that's a big priority right now and a great opportunity. It's really easy to get behind the idea that, wow, let's try to see more patients. Let's try to get patients in quicker and make their experience better here at Stanford Children's Health. So it's just easy for me to get behind and feel excited about. And finally, I just love my enthusiastic and supportive hiring manager. His name is Lee Kwiatkowski, and talking with him and his application was just so incredible that there was no way I could choose anything else. And I've been in the role now officially for a few weeks and am absolutely loving it and feel I made just the best choice. So I'm very happy to tell you about my transition process. Now, I am excited to hand it over to Melissa and Jordan. If this program, now that you've heard a little bit about it and the transition experience, if it sounds like something you're interested in applying to, Melissa and Jordan will tell you how to do so.
Thanks, Maggie. This is Jordan. I'm going to walk you through what our fellowship application process looks like because I am the most recent person to have gone through this process. So just so you know, we are a member of the NAFCAS application process, the National Administrative Fellowship application site. So we will abide by their uniform application deadline of October 2nd, 2019. So if you like planners or Outlook calendars, go ahead and mark that in after the webinar. We do have two different ways to apply, though. The first way is to You can just email your application materials in a single PDF document to our fellowship email, which is listed there, fellowships@stanfordchildrens.org. The materials include a cover letter, resume, personal statement, really discussing what your interest in pediatric-focused administrative fellowship is, your knowledge of Stanford Children's Health, and what your career goals are as a healthcare leader. We also would like your graduate school transcript and 3 letters of recommendation, one from an academic reference, one from a professional reference, and then one of your choice. And then, of course, you can also just apply through the centralized application system through NAVCAS if you choose to do that. So just a little bit about the timeline. Like I mentioned, October 2nd, 2019 is when the application is due, so that's through either the NAVCAS website or directly to the fellowship email. Around mid-October, we start our phone interviews. So from October 7th through 9th, we do first-round phone interviews with our fellows. And then our second round is with Laura, our director of our program, the same week. Late October, we do our on-site interviews and a dinner. On October 28th is when that on-site will be hosted by both Laura and the mentors of the program. And late October, we have, late October, we also have our actual on-site interview day, where we do have steering committee panel interviews and one-on-one interviews with our CEO and president, Paul King. Late October to early November is when we will extend an offer, and that phone call will be made by the fellows. And November 13th, 2019 is new this year, which is the universal acceptance date, which everyone has to accept one of their offers. Just a little bit about our administrative fellowship statistics. On the left-hand side, you can see kind of historically what we've experienced. So we typically have over 115 applications. Out of those applications, the average GPA from graduate school is a 3.69, and we've had 74 programs represented. In the first round, we do offer phone interviews to about 10% of those applications. In the second round of phone interviews, we offer about 10, and again, that's with Laura, the director of our program. And then our third round, which is the on-site interview, we offer 5 of those interviews. And with that, that concludes the informational part of the webinar, but I'd like to open it up for questions and also just remind you that Caitlin and Meher, our former fellows, are also on the line and can answer any questions you may have.
Thank you, my fellow presenters. I know we had a little bit of technical glitch, so if you did not hear me at the beginning of this call, my name is Simran, and I am your moderator today. What I'm going to do is go ahead and read the questions that we are getting. You can use the Q&A or the chat sessions to write us any question. If there are any specific questions related to the application process, we will not be taking them today. And we will reach out to the candidate separately. So I do see a bunch of questions starting to pop. So let's go ahead and take the first one. And we are monitoring both the Q&A session and the chat session. So you can use either one of those mediums to go ahead and ask us questions. So the first one that I see is related to the application process, and we will get back to you separately. If you have generic questions about this program or anything that we shared today, we'll be more than happy to take that. So the first question is, why did you choose to do a fellowship in pediatrics? Did you have prior experience in pediatrics? And I'm going to open it to all our fellows here and see who would like to take our first question.
Sure. I will take our first question. This is Maggie Howell. One thing I just want to note is across the board, we love to see a passion and excitement about pediatrics, but in no way is it a requirement that you exclusively apply to or only want to work in pediatrics. I personally had experience in the pediatric environment, had worked at Children's Minnesota, Children's Hospital Los Angeles, but I do know that several of our incredible fellows also applied all over and had opportunities to work at adult organizations such as Kaiser Permanente, for example, and chose Stanford Children's Health. So while a passion for pediatrics is a great bonus because we are a pediatric hospital, we are looking for candidates who want to be here and have a great reason why they want to be here. That may be pediatrics, that could be some of the many other amazing components that our fellowship offers. So yes, I personally did have experience in pediatrics, and then to answer your first part of your question, why I wanted to be in pediatrics is because I love working with that patient population. I had done a lot of volunteering and working with kids in undergrad in the South Los Angeles community, and that was something that I felt very passionate about. I also love the environment working in pediatrics. I think it tends to draw a certain type of person and a altruistic heart, perhaps. So that really drew me. I think there was a real gut feeling when I went on site here that I got along quite well with the folks at Stanford Children's Health. That is my story. Do you want to go, Jordan?
Sure. I also had a specific passion for pediatrics, but also did have some past experience working in an adult hospital. So don't let that be a barrier. Everyone is welcome in the pediatric world. But I think for me, my little brother had cancer when he was little, so I kind of always just wanted to stay in the pediatric world and had the opportunity to work at Seattle Children's Hospital for the last 5 years. And I guess that kind of transitions into a different question never mind. But I think that for me, pediatrics, like Maggie mentioned, it really takes an altruistic heart, and I think that's where my passion lied and why I wanted to stick with pediatrics is I felt like everyone kind of in this world were very mission-driven, and that was really important to me to stick with in my career.
Thank you, Jordan. So the next one is, the first part of the question is related to the application process, and I'm going to skip that since we are not going to take any specific questions related to recruitment. The next one is, in fellowship program, do you have program for adopting knowledge in global health and global telehealth?
Meher, are you available on the line? Meher is our program manager in digital health who graduated a year before me from the program. Would love to hear your perspective.
Hi, everyone. Happy to take that question. This is Meher Katwala. As Maggie mentioned, I graduated from the fellowship program about a year ago, and I have been in my role as the program manager for digital health ever since. So happy to take that question. As part of the fellowship, as Maggie mentioned earlier, she did do a special rotation for her fellowship in the digital health team. And so there's definitely that opportunity in your second year where you choose to participate in an area of your interest. Just talking a little bit more about the telehealth program that we have here, it's a very robust program. We actually just closed out our fiscal year, and we did above 4,000 telehealth visits total at the organization, which was about a 4x growth from last year, so growing very rapidly. Outside of telehealth, the digital health program also includes several other programs such as on-demand telehealth. We have something called school-based telehealth that we're launching soon. So more than happy to take more questions about that. And if anyone wants to hear more about the digital health program, we also do have a website. So I'm happy to send that over to everyone that's attending the webinar right now.
Thank you so much, Mayor. Moving on to all former and current fellows, how many administrative fellowships did you apply to, and why did you decide to accept Stanford Children's? I think we have answered a little bit about the second part. If somebody would like to answer the first part of the question.
This is Melissa. I can answer, but will also point out that I was a pretty unique fellowship candidate. I did a lot of research, as all of you are by being on this webinar, about the programs I wanted to apply to, and also knew that I wanted to be in California to be closer to my family, so was very sort of strict on what programs I chose to apply to. I made sure that it was a place that I could see myself working for many years. So I only applied to 3 programs, but again, was very diligent in understanding what those programs had to offer, and that is one of the biggest reasons that I chose Stanford Children's Health, because of the robust fellowship structure, the amazing mentorship and executive exposure. But I will point out that I know that's a very small number of fellowships to apply to. It is not typical, and I know our past fellows have typically applied to a few more than that.
Thank you, Melissa. Is there a preference to which method is used to submit applications?
None whatsoever. Apply through NAPCAS, apply through email. It's really meant to give you, as the applicant, the flexibility. We know NAPCAS has a cost associated, but might be more convenient. We know email is free, but does require a little bit more manual work on the back end. All applications are considered equally, and we're really just looking for the content and the candidates. So please feel free to apply whichever way you prefer.
Great, thank you so much. Okay, next one, for any of the fellows, what were your expectations of the fellowship program, and how did the program not meet these expectations?
So this is Melissa. I'll go ahead and answer this one. I would say I had very high expectations, and they were exceeded. I think, I hope from this webinar you can tell a lot of the amazing opportunities that the fellows are offered here at Stanford Children's Health, but speaking from experience, having just finished my first year, what I've already been able to do has been astounding. My project work, my mentors, the executive exposure has really been above and beyond, and I think it is because the leaders of this program and our former fellows have shaped the program to be what it is and have tried to continually improve it. So absolutely have had my expectations met and exceeded, and I think that will continue throughout my second year as well.
Thank you, Melissa. Next one is specific to Jordan. So, Jordan, as someone who recently went through the fellowship process, what aspect of Stanford Children's Health Administrative Fellowship stood out to you the most?
Yeah, I think that for me, when I was interviewing for fellowships, during the on-site visit for Stanford Children's Health, what was really clear was the mentorship and support of this program from senior leaders. Most of them were involved in the panel interviews and showed a genuine interest in the growth and development of the fellows, even as an applicant. And I think the second component was really the culture here. As soon as I stepped foot on campus, just as an applicant, I felt extremely welcome and felt kind of like it was my home, even though I was not even working there yet. So at that point, I really knew that this was the right place for me, and I'm really excited to be here for the next 2 years and beyond.
And we are excited to have you here. Thank you. The next one is a great question. Thank you for the information sharing session. Is Stanford Children's Health open to international candidates for the fellowship program? And I'm going to ask Laura to answer that question.
Thank you, Samparna. As program director, I just want to make super clear that we are open to all qualified 2020 graduates, and so we are looking for the best candidate, the best fit for the organization, and we look at not only your educational background experience, but we're also looking for culture fit for our organization, and we have some qualities that we have that are aligned with our values in our organization that we look for and criteria for that, and so we're really open to that. There was an earlier question, I think it was kind of tongue-in-cheek, where one of the questions was, do you accept guys into the program? So you've heard from a lot of women here today, and the answer is yes. We are open to all qualified candidates that are graduating 2020. So,
thank you, Laura.
Yeah,
that was great. Next question: are there any additional qualifications for consideration for the fellowship program?
I think, as Laura just mentioned, it's really we're looking at what's in the application. So your education, along with your internship or past work experiences, your personal statement, cover letter, resume, and letters of recommendation, until we get to that interview stage where we are looking more for fit and sort of passion, interest, all of those things that we've discussed today.
Yeah, and just to piggyback on what Melissa said, this is Laura. We have been very impressed by all of our candidates that we've ultimately extended offers to and hired and have worked diligently to develop and retain. I would say that, our last couple of fellows, have had some really impressive work experience in addition to their academic experience and all of that. And so, that is something that certainly adds value to any resume. So if you've got some great work experience, make sure you showcase that in addition to your educational internships.
Awesome. And the next question is related to the previous one, but any of you, if you would like to add, the question is, are there any traits that you're looking for in your fellows? And I think we answered that a little bit. I think cultural fit is important. Laura touched a little bit about if you have any additional work experience, please go ahead and showcase that in your application process. Anything else anyone would like to add?
I'd like to add something. This is Laura again. Something unique about working in a children's setting is that it's a very collaborative environment, and our organization in particular is highly relational, and so the ability to build relationships and collaborate, those things we put a high value on. So if that speaks to you at all, we would be very interested in talking with you.
Awesome. Thank you, Laura. Okay. Next one is an interesting one. How was the transition to living in San Francisco? And was there any one thing that made it more difficult or easier in that process of relocating? Maybe finding out how uni works?
I would love for Caitlin Crooks to answer this question, our fellow who graduated 2 years ago, because she has lived in both the suburbs and the city. Caitlin, would you be willing to take this for us?
Yeah, sure. Can you hear me?
Yes.
Great. So yes, I was the fellow now graduating 2 years ago. So I've been out of the administrative fellowship program for 2 years. And my first year I lived in Palo Alto, which, we really do recommend when you come to the Bay Area for your program that you do live as close as you can to the hospital, because it just makes it really easy to go to all the different locations that you'll be visiting as a fellow, whether it's the hospital, the outpatient clinic, some of our joint venture hospitals. Having the ability to be close and go between multiple sites within a day is preferred. So first year I stayed locally, but I do like the adventure of the city, and so I looked up to moving to the city, San Francisco, and that's where I've been ever since. And our organization is really trying to find creative ways for all our hospital employees to get to work in a rather affordable and convenient fashion. So I actually take the Caltrain to work pretty much every day, and that goes directly from San Francisco, the Mission Bay stop essentially, and I take that to work in. And so it's working for me now, and I think because I have a more stable schedule of coming into the hospital every day since I work in the OR, it works for my role and kind of my lifestyle. But I think what we've encouraged the fellows, at least for the first year, is trying to find a spot within Palo Alto, Mountain View, Redwood City area, just for really orientation purposes and getting comfortable if you've never lived in the Bay Area before.
Thank you, Caitlin. That's very helpful. So I just wanted to do a quick time check. We have about 2 more minutes, so we might be able to take 2 more questions. If you were not able to answer your question today, please go ahead and send your question to adminfellow.stanfordchildren.org, and then we should be, is there an email ID that they can reach out to?
Fellowships@stanfordchildrens.org.
Awesome. Fellowships@stanfordchildrens.org. So I'm just going to quickly try to get through a couple of more questions. During the fellowship, what was the most challenging time that really engaged your individual experience?
I'll take this one. This is Melissa. And so I talked about my transfer center project earlier, and one of my favorite things about it was that I got experience handling frontline operations. So when our transfer center opened, we had a 24/7 command center open to help our new employees because the transfer center is a 24/7 operation. I actually worked the night shift, 5 nights, 7 p.m. to 7 a.m., took calls in the transfer center, slept on the floor of the transfer center. I mean, I lived there. And I would say it was challenging mentally because I'm not used to staying up all night. I'm not used to sleeping during the day. But it also gave me a really good look into what our night shift employees go through and the different challenges that they face, and has given me such good, I think, experience to bring forward as hopefully a future administrator who may be working with those night shift employees, but definitely I think was one of the things that was challenging, but also very rewarding. But just as a note, as a fellow, sometimes you get projects that throw you into things like that, and you soak it up as a learning opportunity.
Thank you so much, Melissa. Okay, we have one last question, and we are actually out of time now, but I'm going to take this one. I'm curious what the most notable growth component in the fellows, and this question is specific to Laura, is that you have seen from over the years when the fellow starts to when the fellow takes on their post-fellowship role?
All right, I'm happy to take that question. Thank you, Samperna. So clearly, every fellow that we onboard has tremendous intellectual horsepower, no doubt about it. One of the core competencies that we look at and part of our performance review process, and that's really our way of career development and planning with everybody in our organization, the administrative fellows included in that, is courage. And what I've seen in all of the fellows that I've had the privilege to get to know is a blossoming of courage. And it's shown up at, various different parts of the fellowship, but I'll just give you sort of a sense of it. You got a chance to see the structure of the fellowship program, the fact that there's a seat at the table and there's access to very senior leaders, executives in our board of directors. And so part of having access is also sort of stepping into that seat at the table fully. And sometimes the project work reveals, and research will reveal something where maybe there's a gap in the organization. And having the courage to not only present the research, but also to speak to that gap and potential solutions for it. And sometimes that can feel a little bit risky, but what I've seen in every fellow that's come through our program is growth in their confidence and courage and ability to speak up. And one thing I'll just say as kind of standard work for us, every single fellow who comes through our program, one of the first things we do is we offer them the opportunity to go to the Power Speaking headquarters right here in the Silicon Valley, where all the Silicon Valley executives get their presentation skills training. And we send our fellows there as just part of our practice to get them real comfortable in presenting to very senior people. There's a Power Speaking program and a Speaking Up program, and it's part of our offering to develop our fellows in addition to many other offerings. But, just really an opportunity to speak in publicly and having the courage to do so in all kinds of different settings. I think I've said enough here. Samperna is giving me the wand. So I will wrap it up on that and just thank you all for tuning in today. What a pleasure to have you join us. And again, just so excited about this program, where it's come from, where it is today, and where it's headed.
Great. Thank you so much, Laura. We're actually 2 minutes over, and I'm going to ask the panel members, we have 2 more questions, and is it okay if we quickly take them and wrap this up, or would you like to reach out to them separately? Either way is fine. I do see a few attendees that are leaving the webinar. We just wanted to make sure we answered all your questions. I think we talked a little bit about demographic struggles. So the one last question that is left, and it is, will you accept applicants who graduated in May 2019, or is a 2020 graduate year required? Let's go ahead and take this last one.
May 2019, it's on our website, I'll have to look. You have to have not been eligible for our program last year. So I believe that May 2019 would make you eligible for the program this year. But we'll confirm and respond to you.
Great. And if you want more information, you can go to adminfellow.stanfordchildrens.org. And if you have any specific questions to the recruiting process, you can write to fellowship@stanfordchildrens.org. With that, thank you so much for joining us today. Hope you have a great weekend, and If you have any questions, write to fellowship@stanfordchildrens.org. Hope you get to enjoy some time off over the weekend, and thank you again for joining.